very difficult to know what to expect if your family is going to endure a cancer treatment. And I think the best advice I can give in the years of working with kids is making sure that you realize you're not alone. The biggest thing is that you're going to have a team, and relying on that team, relying on your family members, finding out who is going to be there for your support will help make this journey a little bit easier. There are some commonalities in cancer treatments and cancer patients' experiences, but there's a lot of uniqueness too, and so we really try to look at what each patient individually needs and what each patient, how they respond to certain things. For instance, if you know a chemotherapy is going to make you nauseated, what can we do for that nausea? What can we help that patient find that helps them specifically that may not help somebody else? So we look for those special little things as a team, what's going to help that patient cope a little bit better. One of the ways that we can mark a child's journey with cancer is through a tangible item like beads of courage. So each bead that a child would get would represent something that they've endured during their treatment sessions. So a black bead would be like a poke, blue beads would be a clinic visit, lumbar punctures, blood transfusions, clinic stays or hospital stays. Each bead's going to represent their journey, and they can put them on a necklace with their name, and they wear these just like medals of honor. They've endured their treatment. It's a great way to be able to communicate to family and friends what is going on in their treatment and how cancer has affected them, and a great way to communicate amongst one another and peers of what their experience has been. Instead of talking about pokes, they can show how many pokes they've had or how many chemotherapy treatments that they've endured. So it's just a great way to make each person's experience with cancer unique. It's very important as you learn to navigate this journey that you know that you're going to get through this. And it is a journey and it's a process that you're going to get through. So not focusing so much on the end or the doom and gloom, but looking towards the future, trying to stay as hopeful as you can. Be mindful of everyone in the family, especially those siblings. Give them the time that they need to cope with this also. The patient gets a lot of support. There's a lot of people looking at the patient, talking about the patient. You spend a lot of time talking about your child who has cancer. It's the siblings that kind of go into the shadows during those treatment sessions, and so making sure that they have some light shined upon them too during this treatment, and knowing how important those relationships are.